Welcome back to Jersey Matters. I'm Larry Mendte. New Jersey and the rest of the country is suffering a COVID-19 vaccine shortage. But help is on the way, according to one of the men in charge of getting the vaccines to New Jersey. Here's my interview with Patrick Kelly, Executive Vice President of the Healthcare Distribution Alliance. Sir, thanks for spending some time with us. I guess we should start with telling people what the Healthcare Distribution Alliance is.
Great question, Larry. So we are a national trade association representing the pharmaceutical distribution segment of the supply chain. So our members are the companies that move all of the pharmaceutical products, or not all of them, more than 95% of the pharmaceutical products sold in the United States move through distribution through our member companies.
Now people are kind of hyper-focused on you because they're hyper-focused on the movement of the COVID-19 vaccine. In your opinion, how is that going?
Well, again, I think it's by no means a perfect success story to date. I think this is obviously an unprecedented situation we've never had to deal with before. From what I understand, again, and what our members are telling us is when the supply becomes available, it is moving as quickly as humanly possible to the points of administration at the state level. So there's not like an inventory of untapped product that's waiting to be distributed. We're dealing now with just two companies that have product on the market. They're manufacturing as quickly as they possibly can. And so there's just not enough product in the supply to go around at the volume that the states are able to utilize it. So that's one problem. On the back end of that, we've got a problem in the administration site, where we're trying to basically, states were left to their own devices to make this work. So they have to basically set up the prioritization plans. They've got to figure out whether they've got the locations and the personnel to administer the vaccines. Then they've got to deal with basically, creating the scheduling apparatus that allows people in your state, New Jersey, to say, I'm now 65 and older, eligible for the vaccine. Where do I get it? Fortunately, on the supply end, I think with Johnson & Johnson's product, probably approved by the end of this month, we're going to see more supply coming into the environment, and the supply issues should begin to resolve themselves. It's getting those vaccines in arms that's going to continue to be a challenge moving forward.
Let's talk about Johnson & Johnson because it's a big New Jersey company, and they're going to play an important part in this. Do you believe they're going to be able to supply that much of a significant amount that we can get back to where we were supposed to be?
It will be a significant help, and there help on a variety of fronts. Number one, the sheer volume of product available to administer. So that's one significant asset of them coming online with their product. The other aspect is this is the first one-dose vaccination or vaccine that's been approved to date. And it's also doesn't have anywhere near the handling complications that the Moderna and Pfizer vaccines have that have to be maintained at ultra cold, ultra frozen levels until they're actually administered. The Johnson & Johnson vaccine is regular cold chain, which is your typical refrigerator in your house. It moves through the supply chain it's one dose and you're done. But right behind Johnson & Johnson, we have AstraZeneca. And then maybe Novavax and some other companies are coming online with more capacity, and then Emergent Biosolutions, which is a contract manufacturer that's going to help produce the Johnson & Johnson vaccine. In April or May, we could actually have a glut of product.
That would be nice.
Right, it would be a nice problem to have. Yes, I'd rather have a glut than no supply at all.
Because right now, I know people that are on waiting lists, and I know that they've been waiting for a long time, and you can't even sign up some places because they don't have enough vaccine right now. And it's frustrating, especially for people who are vulnerable that they can't get the vaccine. But when we do get this glut, let's say, when we get enough of the vaccine, I know you've been dealing with CVS and Walgreens and a lot of people who are going to help distribute this. That's going to be crucial at that point, isn't it?
Absolutely. As we can move into kind of the retail setting rather than these mass vaccination sites or taxing our hospitals, which are already overtaxed with the number of people that have the COVID disease, if we can get it into a retail setting, which really makes it much easier for you and I during the course of our regular workday to say, I'm going to go down. I may have to wait in line an hour or so at the CVS, but it's an option available to me that's right down the street. The other thing that's a major challenge here, and we heard this on a call last week, these vaccination sites are able to vaccinate people to the clip of like 1 or 2 people per minute, maybe 3 people per minute in a good clip. Now, those people have to go sit down for 15 minutes, make sure there are no adverse events, but you can kind of vaccinate relatively quickly. The challenge now that some of these states are having is the data entry for each vaccination can take 3 to 5 minutes. So you've got to go as soon as Patrick Kelly gets the vaccine, somebody's got to go record that Patrick Kelly, who lives in Bethesda, Maryland, got the vaccine at this location. It's a booster required by Moderna in 28 days. He needs to come back and be eligible for the vaccine. That data management component is now, I think, the biggest challenge ahead of us as we expand this vaccination process. So we're learning as we go. And we will refine this, and we will commit to getting through this. We will work with our pharmacy partners and our hospital systems and dentists and other entities that can come online to help vaccinate people. And we'll figure out how to get it done. We've never done this before. So we're kind of learning as we go.
Thank you, sir. You've been a wealth of information. I really appreciate your time.
Patrick Kelly of Healthcare Distribution Alliance. Still to come on Jersey Matters. Ever hear of Zoom dysmorphia? It's causing people to go to cosmetic surgeons in record numbers. We'll explain next.